Hey there. So today let's talk about pelvic and vulvar pain in trans and non-binary bodies. While some healthcare providers see this as primarily a cisgendered woman's health issue, that's actually just not the case. Now, today's video, we're going to talk about 3 things that many healthcare providers don't tell their trans and non-binary patients when it comes to pelvic and vulvar pain. I'm Kana Cassard, and I've been helping vulva owners and couples recover from the impact of vulvar and pelvic pain, lack of arousal, and issues with intimacy since 2006. Today we're talking specifically about pelvic and vulvar pain in trans and non-binary bodies, and despite many advances, the binary structures of medical care remain deeply entrenched, which can be difficult, if not downright traumatizing for patients to navigate. Now, thankfully, the healthcare system and community is slowly becoming more aware of the unique needs of trans and non-binary people, and today I'm hoping to add a bit more support to move through your journey. Now, here are the 3 things that medical care providers don't tell you about pelvic and vulvar pain that you do really need to know so that you can go through your journey a little bit more empowered, and I'll help you to understand how you can address these 3 things. So now first, your pain is not in your head. Your pain is real. And even if your healthcare providers don't see anything that's wrong or damaged with your tissues, that doesn't mean that what you're experiencing is not real and that there's not actually something going on that needs to be addressed. Conditions like vulvodynia or vestibulodynia are often unrecognized by many doctors, even gynecologists. And if you're experiencing anything that's like a sharp burning pain or like a cut, that might be indicative of having some sort of tissue damage or issue that needs to be addressed with hormone creams, physical therapy. There might be some nerve damage, so other kinds of creams that can be actually applied to the genitals will be really important. So the second thing that is going to be important to look at is that changing muscle structures and your posture can actually cause pelvic or vulvar pain. When you're born, your body frame might have been designed to move in certain ways and to have a certain kind of muscle structure and density. So now if you're moving through an affirming journey and changing the way that you move, your body shape, or taking hormones to change your body shape, this can actually make an impact on your posture, your core muscles, and your pelvic floor muscles. But not to worry, there are wonderful gender-affirming pelvic floor physical therapists who can help you align your body so that these changes move effortlessly for you and don't create pelvic floor dysfunction or any sort of genital or pelvic or vulvar pain. Number 3 is creating a mind-body connection, and that is just going to be crucial for any sort of healing journey that a person is going through. And you've been through a lot, physically, emotionally, maybe even spiritually, not to mention the traumas that many trans and non-binary people have faced as a result of being in a society that is really less than welcoming to anything outside of their binary expectations. And all of these things take its toll on mental well-being. Now, when people have been through difficult times, especially traumatic experiences, being embodied might not always feel safe. And then the impact of this is that the nervous system might be in a chronic flight or fight state, which causes muscle tension, toxic neurochemicals to be overwhelming in the body, and this will increase the pain experiences in the pelvic floor and in the genitals. So now what to do about it? Well, it's really important to create a healthy mind-body connection with a specialized mental health professional and possibly even engage in somatically based trauma reprocessing so that your body and mind can learn how to feel safe again. So you're on a beautiful path to feeling more aligned with yourself, and I'm super excited for you. And hopefully you have a great affirming healthcare providers that are in full support of all of your needs. So today we talked about 3 things that healthcare providers might not realize is a part of your journey, but my hope is that with this new information, you might even feel more empowered and to get that support that you do need. If this video spoke to you, you might like the others on my channel, so be sure to subscribe and hit the notification bell so that you don't miss inclusive and impactful pain relief and powerful pleasure building tips, tricks, and expert advice. Plus, when you subscribe and watch, it tells the YouTube powers that be that this information is helpful and they'll get it to others like you who might need it. Thanks for watching. See you around soon.